For that wonderful presentation, Vivian. Now I call upon Dr. Mohita Sharma. She again doesn't need any introduction. She'll be talking about laser capsular hexis. She is the chairperson of Tirupati Eye Center, Noida, and also the president of the Women of Ophthalmic Society. Over to you, Dr. Mohita.
Good morning, everybody. So after hearing a lot about cataract and what all can be done in various type of cataract surgeries, I'm introducing a new technology to you, which is called advanced laser-assisted capsulorhexis. Now, what is this advanced laser capsulorhexis? It is a customized optical laser delivery unit for a precise capsulotomy during cataract surgery. Now, we all have been doing capsulorhexis ourselves, whether using a needle or using a capsulorhexis forceps. But currently, with the coming of the presbyopia correcting lenses, there is a need that our capsulorhexis should be absolutely circular. Capsulorhexis should be of a desired size, and we should have consistent results. So this is the equipment setup. You can see that there is a console, and this is a console which is attached to our own regular microscopes. This is actually in the study stage, but will soon going to come into the commercial market. So that is why I'm introducing this technology to you, and I've been working on this for last 2 years with Appaswamy Associates. So this is attached to the microscope, and this is the laser module demonstrating the front panel, where you can see various settings. And the good thing about this hexis is we can actually customize the size of our hexis that we want, and we can vary it from 4.5 to 7 millimeters. So as I said, what is the need? Reproducibility and consistent outcomes. And for our precise lens positioning and centration of our current presbyopia correcting lenses, we need accurate capsulorhexis. So we started by doing an animal study with 50 eyes, using all ethics that were applicable to animals. And these are the kind of results that we got in our animal eyes. And after this, we started with, and these are the retrieved anterior capsular flaps, which were analyzed in the electron microscope. And it was found that these flaps had outturned edges. So this was probably responsible for the hexis having a very good strength when we actually did it on humans. This is the patent certificate, and this is how it gets attached. It just comes as an attachment which is attached to the microscope while we are doing the surgery. Now, what is so unique about this? The design, which is a customized laser for laser delivery, the efficacy, because it gives a higher capsular, it's a very high capsular edge tear strength, and the technology, because it gets seamlessly integrated into our regular microscopes. The advantage over other technologies is, for example, Femto and Zepto, etc., which have been available. One is that it does not require additional suction effect for globe centration. And secondly, we have done it on almost all types of cataracts, except for the fibrotic capsules. All other capsules, it has given good results. As I said, it has a high capsular edge strength. If we compare it, say, with Zepto, which had a kind of a zigzag kind of a hexis, this is basically a coagulating laser. So that's why the hexis is continuous. And since it's indigenously made in our own country, it's going to be much, much more economical than any other technology. So I'll just show you a short video of this. So as I had shown before, this is the attachment which gets attached along with the laser filter, which is switched on for protection. This is a regular phacoemulsification being performed. Staining is very, very important in this. The two different things that we do compared to any regular cataract surgery is, one is the stain that is used is of higher concentration, and secondly, the viscoelastic is also of a much higher concentration, because these have been optimized by trying various permutations and combinations to find out which is the medium through which laser will travel the best, and which is the concentration of the stain where the laser uptake will be optimal. So this is the hexis being performed. As I said, staining is a very crucial step. So if we find the staining is not adequate, we may restain. And as you can see, these are the kind of flaps that are achieved. And again, we have sent them for scanning electron microscopy, and we have found that the rhexis margin is actually kind of interned, and the margins of the margins of the flap are outturned, and maybe that is the reason why, as you can see, we are pulling with two instruments, and yet it does not break. And this is especially what I've chosen to show to you is a hard cataract today in this case, because even when we are we have tried in very hard cataracts also, even when we are maneuvering the pieces out, the rhexis does not rip apart. So it has a good strength. And as I said, we can choose how much of the size of the rhexis we want. If for small people, we can even go for 4.5 or 5 millimeters of rhexis, and followed by lens implantation. So this has been worked out after, as I said, with a lot of permutations and combinations on how much is the adequate power, how much is the stain concentration, how much is the visco concentration, to get finally what we want. And we are in the final stages, and this is one case where restaining was done. This is the crucial step. Staining has to be adequate, and contraindication is there is a corneal opacity, because then the laser does not penetrate very well. We have also done specular counts to find out if there is any effect on the endothelium, and we found that it is like a regular phacoemulsification laser, does not damage the endothelium also. So this is about this new technology, which you will soon hear about, and this was an introduction to this technology. And before I end, elections AIOS are around the corner early next year, and since I am a contestant, it is my duty to inform you all that I am contesting for Joint Secretary, and I would need your support. I've been the Secretary of Women Ophthalmology Society as well as of UP State Ophthalmological Society for last 7 years, and if given an opportunity, I would like to serve in AIOS too. Thank you.
Thank you very much.